Hey, I'm Dr. Rich. Recently, a viewer commented on one of my videos about how the cost of a full mount of dental implants today is equivalent to the price of a house back in the 1960s and 70s. So that got me thinking, I wonder how much other dental prices have changed since the 50s, 60s, and 70s. Well, it just so happens that in my office, I have a paper chart for a patient. This came with the office when I bought it back in 1998, and attached to the back of the chart is the patient's chart from their previous dentist. And this chart ends up dating back to the 1950s. 1951 was actually the first entry on this chart. So we're going to go over that, some of the costs back then. I'll talk about how it compares to costs of dentistry nowadays. I'll even talk about some of the materials that were used then and which ones we still use today and which ones we don't use, what materials we use today that weren't even available back then. All right, so let's take a closer look at the chart. All right, so here's the chart. That's one thing that's changed quite a bit since in the old days is dental charting. Now, dentists, we all actually write quite a few notes based on what we're doing, what we're administering, the materials we're using. Back then in the 50s, so see, first entry, October 31st, Halloween, 1951. Basically the chart, all it consisted of patient's name on top. I edited that out, so I folded it over so you don't see that. And then just a list of the services rendered and the cost. So basically, first thing that was done, cast gold crown. So this is a full gold crown that was done on a back tooth. This person kind of uses different notation depending on the tooth. Some uses the universal numbering system. Some he just kind of goes off the midline like an orthodontist does. But the first cast gold crown and X-rays on tooth number 14, I believe, $50. Wow, that seems like it was quite reasonably priced for a full gold crown for $50 back then. Well, you also got to remember, gold was a lot cheaper back in 1951. I looked it up, and an ounce of gold in 1951 was $40 per ounce. That ends up being $1.41, so $1.41 per gram. An ounce of gold today, when I'm filming this, which is February 2024, an ounce of gold is $2,025. So per gram cost, that works out to be $65.14. So $65.14 per gram of gold. So, the fee back then for the gold crown, as I said, was $50. My fee for a gold crown is about $1,800. So it sounds like it went a bit more. But if you compare it to the cost of gold, crown was actually more expensive back in 1951 than it is today. If you ever read any of the financial papers or anything about investing in gold, there's a rule of thumb that gold investors say that gold is a great store of value, so that years ago, an ounce of gold was worth the price of a good men's suit. So in the 1800s, if you had an ounce of gold, you could buy a nice new suit with it. Same as today. An ounce of gold will buy you a nice suit. Although $2,000 is pretty pricey for a suit. I don't think I've ever spent anywhere close to that for a suit. Trying to think when's the last time I wore a suit. Way before COVID. But the gold fee is only a small part of the cost of the crown. That's just a big part of it is labor. So labor being how much the dental lab charges to actually make the crown. So you might be wondering, how much gold is in a crown? Well, I happen to have an old crown, full cast gold. So let's weigh it and see how much it weighs. Okay, I have this scale set in grams and zeroed out. And it looks like it's 3 grams worth of gold in there. So what did I say was priced back then? So this is just an average, and you got to remember though too that the ounce of gold is considered 24 karat, 99% pure gold. Dental alloys are not 24 karat. They're maybe at the most 18, but that's pushing it. Usually they're about 12 carat, so they're a little bit tougher. So, but at $1.41 per gram times 3 grams, it was $4.23 of gold back then. Nowadays, gold's $65.14. It's $195.42 worth of gold. So costs have come up, definitely. I think the last full cast gold crown I made, the lab actually charged out the two things separately. They charged me their labor fee, basically the cost to make the crown, which I think was $150. And then the gold alloy fee was on top of it. And I think at the time the alloy they were using, I think it ended up being $250. So a lot more pricey crown. But you got to remember, in 1951, this was before all the new fancy porcelains like Emax, before zirconia. Porcelain fused to metal crowns weren't very common yet either. For a back tooth, they basically did all gold crowns. I think porcelain fused to metal came out in about 1960s, thereabouts. So this was the go-to crown choice for a back tooth. Also, for front teeth, occasionally they'd be done in gold on front teeth, but on front teeth they would do something called a porcelain jacket crown. It's just regular feldspathic porcelain, similar to your fine china of a dinner plate, and that was just cemented on. Those tended to be, they looked good, but they were very fragile, and it was very common for those to crack, chip, break, and need to be replaced quite often. So they're only done as an absolute last resort. All right, let's see some of the other costs that were on this chart. So next one down in January of 1952 was a DO silver filling. So DO means it's a distal occlusal, so it's basically a two-surface silver filling. So it's the biting surface of the tooth and then the back side of it. And that was $7. So my fees nowadays for a two-surface silver filling is $265. Bit of a difference there. Scaling, next one down, that's basically a cleaning. And you can see down here there's a line item for cleaning as well. That was $5. Nowadays, what's a dental cleaning? I think in my office, a dental cleaning is $175. Quite a difference. X-rays, $5 for a set of X-rays. I'm assuming those are just bite wings. It doesn't say bite wings or full mouth series, but I think it's just going to be for X-rays. And then up here, D porcelain filling and M porcelain filling. So this was for tooth 1 and 2, but I have a feeling this is for this is a different nomenclature that this dentist was using. So this is probably, this number 1 tooth is probably what I would consider tooth number 9 today. So basically it's the upper front left central incisor. D means it's on the back side of it. Porcelain just means it was a white filling. But it's not the type of porcelain that we use today in dentistry. Again, which is, when I say porcelain, when I'm making something out of porcelain, it's either going to be a crown, inlay, or an onlay. Back then, the common white filling material for front teeth was a material called a silicate cement. And I'll put that on the screen so you can see how it's spelled. Basically, it was silicate cement was a cement made out of alumina, and silicate glass mixed together with a binder placed into the tooth. And so that was the only material that was sort of white colored. It worked. I've seen some old ones on patients. Plus side is they rarely got cavities because they did release fluoride. Downside is on some people, they would kind of melt away very quickly, just basically dissolve in the mouth. I think over the years the formula must have changed because it got a little bit better. And the newer ones didn't dissolve quite as quickly. Now you got to remember, dental bonding as we know it today, where we can bond on veneers, bond white fillings on front teeth and in back teeth, bond crowns in, bond inlays and onlays, bonding like that with acid etch was not invented until 1967 by Dr. Buonocore. So prior to that, we were just, they were using the cements, and then for cementing the crowns, the dentists were using zinc oxide, ZOP cement, zinc oxyphosphate, or ZOE, zinc eugenol cements. And they were just luting the crowns on. There's no bonding at all. Another thing to keep in mind is the 1950s, there was a big new development on the market in dentistry in the 1950s. That was the high-speed drill. Prior to that, dentists only had the slow-speed drill. You know, the one that kind of grinds and slowly vibrates your tooth. Starting in the early 1950s, the high-speed came out, and that pretty much revolutionized how much and made it more simple to drill teeth and to place fillings, drill teeth down for caps and crowns. All right, let's go down the list, see if there's anything else that we can see. Let's see, we got some extractions on here. An extraction was $5. This is the upper right. This is the right side tooth number, the 8. So I'm assuming that's going to be a wisdom tooth. Again, that's more the orthodontist way of numbering it. I forget the name of that. I typically use the universal numbering system, which, you know, start off tooth number 1 is your upper right wisdom tooth. Go count them all the way across till you get to number 16, which is the upper left wisdom tooth, down to the lower left wisdom tooth, number 17, and then you count them around to number 32, which is the lower right wisdom tooth. All right, and then a few more fillings, some silver fillings, some more of those porcelain fillings. Also an apicoectomy and a root canal. Wow, so that was $40, so that was pretty great. Gold post and core, $35. And that was for a front tooth. I think that's for the lateral incisor. And so this person is still a patient of mine to this day. They're in their mid-90s now. They still have that tooth. I'll have to double check the x-rays, but I believe that post is still there in that tooth. All right, so thank you guys all so much for watching. I hope you found this little video interesting. A little trip down memory lane in dentistry a little bit, and to see how far we've come with some of the techniques and materials. Some of the prices have increased quite a bit since then too. This was back too when implants weren't available back then. A lot of the fancy porcelain, modern porcelains we have now were not available. Dental bonding, not available. Back tooth, you're basically looking for a silver filling or a gold crown. Front teeth, you could still get the silicate cement, or if the tooth warranted a crown, you get a porcelain jacket crown. All right, so thank you all so much for watching. See you in the next video.